Hello everyone. Let's talk about childhood asthma today. Parents often fear that asthma is a condition that is labeled in a hurry without proper diagnosis, and they worry that the stigma will stick with the children for life. So childhood asthma, yes, it is a common condition which is affecting the lungs and is characterized by inflammation, that is redness or swelling of the conducting airways, and which presents usually as episodic difficulty in breathing, particularly as wheezing, and can often be triggered by exposure to dust, smoke, or other chemical irritants, or sometimes follows infections. Doctors often like to classify children as under 5 age and above 6 years in diagnosing asthma. It is often difficult to diagnose asthma in under 5 children, and usually the doctor will prescribe medicines and see the effect of the medicines in what is called as a therapeutic trial to see if the child fits into what is called as under 5 user or childhood asthma. It is more likely that your child may have asthma if there is recurrence of symptoms without any fever or cough, there is a family history, or the child himself has recurrent wheeze or other allergies such as eczema. In this case, the child is more likely to be having an asthma. In above 6 years, lung function tests such as spirometry are often performed, and especially when the child is having a bout of wheezing, and that can give clues to whether the child is truly suffering from asthma or not. The hallmark of asthma is the reversibility of this breathing difficulty after medications, and this will be also noticed on the pulmonary function tests or the spirometry. Some of the triggers for asthma include household smoke or dust, animal dander. Cigarette smoking by one of the adults is also a very common trigger for childhood asthma. Presence of pets such as cats and dogs, presence of animal hair also are known triggers for asthma. Viral infections most commonly trigger asthmatic attacks in younger age, that is less than 5 years of age. Another important trigger for asthma, particularly in Bangalore, is seasonal allergies, and that relates to inhalation of pollens. This is particularly seen in spring, where the child presents with breathing difficulty or wheezing attacks, and it is episodic and periodic and only responds to medication or anti-allergic treatment. How does one recognize flare-ups of asthma? Important steps in management of asthma are having an asthma action plan. What do I mean by an asthma action plan? First and foremost, the diagnosis needs to be confirmed and verified by a physician. Once the diagnosis is known, one must have an action plan. One must educate oneself, the child, and the family, as well as school and teachers, that this child is an asthmatic and can have periodic wheezing attacks, which can on occasions become very serious and require immediate attention. What is this immediate attention? A child with asthma often has medications prescribed for controlling of symptoms. Now, sometimes it is a good idea to carry this medication to school, particularly after exposure to dust or after physical activity, sporting activity. If the child then develops a wheeze, the doctor may have advised to use a particular amount of puffs of the medication to relieve the symptoms. And it will be a good idea to use these medications as a first aid. When a diagnosis of asthma is made, it is important to avoid the triggers, as we mentioned a brief while ago, such as dust, pollen, or exposure to smoke. It is also important to keep oneself well hydrated, particularly during viral illnesses, prevent exposure to cold. It is important to prevent exposure to animal dust, animal dander, or carpet dust, which are easily missed at home. While managing asthma, it is important to know that asthma control is what we are trying to achieve. We don't really know if there is a cure for asthma, and only your doctor can tell if further additional steps are required to investigate or treat asthma. Asthma medications are usually in two categories. One are what are called as reliever medications, which are used for acute attacks, and the other are controller medications, which are used to prevent successive or repetitive episodes of asthma. I hope this short video has given you some idea about asthma. If you are in doubt, please visit your pediatrician. You could also visit a pediatric pulmonologist or an allergic specialist here at Aster Whitefield and get your child examined and assessed as to whether they have asthma and what treatment might be necessary for the same. Thank you for watching this video.